Hello friends, my name is Dr. Subodh and this is my YouTube channel Learn from Psychiatrist. Now in our previous videos we have talked about brain, mind, how they actually work, what are their common functions and how mental health should be understood in a very simple manner. In this video we are going to talk about the actual working model of mental health, that is Biopsychosocial Model. But for this video I have improvised this model into Biochemical Psychosocial Model. Now, Biopsychosocial model says that our mental health is connected and can be affected by different aspects of our life, including our physical health, our mental health, including mental illness, and our social circumstances. But it does not talk much about the potential effect of any chemical on our brain. Now, these type of chemicals could be prescribed medication or any kind of illicit drug somebody is consuming. Now, chemicals, they have potential impact on our brain. Actually, our brain needs some sort of chemical to work. So if there's any chemical change in the brain, it is expected that it is going to affect our mental health. That's why it's really important to understand what kind of impact chemical can have on our brain. Okay, so consider mental health like a chair and you are actually sitting on it. So a normal mental health allows us some stability and we can sit on that chair. Now there are four legs of this chair. Consider first leg as biology, second like chemical, third psycho, and fourth social. So the first leg is about bio, that means our physical health. So if somebody is having any problem with their physical health, it can actually affect their mental health. Now, for example, if somebody is struggling with arthritis, they can experience pain, they can experience limited mobility, which in turn is going to affect their day-to-day routine, including their capacity to work and enjoy their routine. So obviously, they're gonna feel bad about it. So it can actually affect their mood and their mood can actually dip. So second leg is chemical. Like I talked earlier, chemical may include any prescribed medication like antidepressant or antipsychotic or any prescribed medication which can actually affect your mind, including painkillers like tramadol. It also talks about any illicit or street drug or commonly consumed chemical like nicotine in form of tobacco and alcohol. So chemical, they can actually have potential impact on our brain. They can actually affect how we feel about ourselves, how we feel about others and our situation. For example, if somebody is drinking alcohol, for a temporary period, it's going to calm our brain and we're gonna feel less anxious. But if we are withdrawing from alcohol, probably it's gonna worsen the anxiety and we're gonna feel withdrawal symptoms. Somebody who's taking cannabis or cocaine, for a short period of time, they are going to feel a rush or a euphoria, a pleasant sensation. However, later on, when the chemical is leaving our body, we can feel a crash and we're gonna feel bad about ourselves or our world. Now the third leg is psycho. That means any mental illness. If somebody is having any kind of mental illness, it is going to affect our overall mental well-being. For example, if somebody is depressed, they're gonna constantly feel low in their mood. They're gonna have very negative thinking or dark thoughts. If somebody is having mania or hypomania, probably they're going to have very high self-esteem, they're going to have grandiose ideation or maybe delusion of grandiosity, overconfidence, lack of sleep. If somebody is having anxiety, probably they're going to doubt about themselves, they're going to feel inferior. The last or fourth leg is social. That means our personal or social circumstances. Our mental health always react to our personal and social circumstances. For example, if somebody has lost someone who was very near or dear, they're gonna feel sad about it and it's obvious, but that doesn't mean that they are depressed. It's an obvious reaction to an adverse life event. If somebody, suppose, wins the lottery, probably he's going to be extremely happy, but that doesn't mean that this guy is manic. Also, if somebody's having any stress at work, probably at home, in their relation, or if somebody's having a financial problem, they are going to feel bad about. They're going to feel low in their mood, probably frustrated, maybe irritable, and sometimes they can be angry. Accordingly, their thought can vary. They can think very bad about their past, present, or future. So now it is very clear that if mental health is taken as a chair, for its stability, it depends upon four legs. One leg is your physical health, other is any chemical or psychoactive substances, the third leg is any kind of mental illness, and the final or fourth leg is your personal and social circumstances. A normal mental health is reactive. It reacts to our conditions, which may include our physical health, our mental illness, or our personal social circumstances. So, if somebody is having a mental health problem, that does not mean that this person is having a mental illness. Sometimes, or mostly actually, in most of the cases, our mental health is affected by rest of three legs. And sometimes we knock the wrong door for answer. So that's really important, how we understand our mental health, how it is connected to different aspects of our life, and how it can result in mental health problems. So if you have any further question, just let me know. You can comment and you can raise any queries. I'll be more than happy to answer. If you like this video, hit the like button. If you want to learn more about mental health, just follow and subscribe my YouTube channel. This is for today, and I'm gonna see you in my next video. Till then, take care. Bye bye.